Hi everyone, thanks for tuning in to our GI Research on the Road. This is the last day of Digestive Disease Week here in San Diego, and joining us today we have Dr. Eswaran, where she is a gastroenterologist at Michigan Medicine, where she provides dedicated care for patients who suffer with celiac disease, irritable bowel syndrome, diet-related functional gastrointestinal diseases, and a wide variety of other gastrointestinal disorders as well. So thank you so much for joining us today.
Thank you, Haley. It's good to be here.
Thank you so much. So today we're actually going to speak with Dr. Eswaran about some of the differences between food allergies and intolerance. We know a lot of people have questions about this, and for many people with intestinal issues, knowing the difference between the two things, the food intolerance and the allergies, can be a bit of a challenge. So just being able to understand those differences would be great. And so again, we appreciate you coming here today to just explain those differences to us.
Absolutely.
Yes, thank you. So can you just tell us a little bit about food intolerance and allergies and what it means to be allergic to certain foods?
Yeah, so I think that is a really valid question that you bring up, and I get that question a lot from my patients. So a food allergy is when the immune system reacts in a harmful or dangerous way to a food that's usually perceived by the body as innocuous or even normal. So food allergies are really common, and you see them a lot in kids. They usually present or diagnosed pretty early in life as babies are starting to eat table foods, transitioning from formula or breast milk. And the most common food allergies are peanuts, tree nuts, soy, milk, and shellfish. And so, again, these are something that kids will get diagnosed with early on, and then may grow out of, but not only. And so, what a food allergy is really is that immunologic reaction, and resulting in either like a harmful reaction or a very unpleasant reaction by the immune system.
Oh, that makes sense, and I think that really does answer some of the questions as far as, is it something that you develop at an older age, or is this something that you're kind of born with, so that you're at least from if you are diagnosed with something, and to know that might be something you're
Yeah, a food allergy can happen later, like in adulthood, but it's more rare.
Okay, that makes sense. So can you just tell us a little bit about food intolerance then, and what that means to be intolerant to some certain foods?
Sure. So a food allergy and intolerance may kind of be slightly similar in the symptoms, but the reasons for them are quite different. So an intolerance is a unpleasant and not usually dangerous reaction to a particular food or type of foods that happens for other reasons, not related to the immune system. So usually it happens when the body or the GI tract is reacting to the presence of that type of food, either with abdominal pain, bloating, nausea, or vomiting, but it's not usually associated with any things like rash or anaphylaxis. So as stated, it's really it can be equally unpleasant, but usually not harmful or dangerous.
Okay. So then you would say that the food allergy is more could be harmful versus the intolerance. You don't see that in some patients? Right.
The intolerance is usually more unpleasant or uncomfortable, but it's not ever life-threatening or necessarily harmful.
That's a good thing to know.
To keep that in mind.
Yeah, to keep that in mind.
And also, food intolerances can kind of happen at any age, and you can develop them over time. So one thing you may be able to tolerate as a kid or a college student, as we get older, people may find that they're not able to tolerate certain types of foods at all, or even in larger doses, for example.
Yeah, that's something that I think a lot of people have also said before, where I could eat this before, and now I can't.
Right. When I was a kid, I could eat all the pizza I wanted, but now I get heartburn with one thing, and so it's not an allergy, but it's for whatever reason people aren't able to tolerate that kind of thing anymore.
Yeah, so now that we know the difference between those two, what's the best way for someone to determine that they're allergic to a food or that they're intolerant of a food?
So food allergies generally become pretty apparent, as I mentioned, like early in life, and there are certain diagnostic tests that your doctor can conduct to see which specific food allergy and how allergic one is to that, because that can vary as well. Food intolerances are definitely more tricky to diagnose, so we don't really have a great way to make that diagnosis other than someone's symptoms and trial and error. Okay. There's no blood test, there's no scan or X-ray I can do to say someone is allergic to a certain type of food, but usually it's from past experiences and exposure and then the subsequent reaction that patients may suspect that they have a food intolerance.
What are some of the ways then that you kind of diagnose people that might be allergic to certain foods? What are some of those diagnostic tests like?
Well, it's often a food that we might see pretty commonly in everyday life. So dairy products or lactose-containing dairy products, or wheat products that we're eating kind of like all the time. So really the only way to diagnose that is eliminating particular foods and then reintroducing them to see what kind of reactions occur, if any.
Right. So with the re-implementing those foods, like what does that look like for a person?
Right, so if a person may have symptoms very similar to irritable bowel syndrome with potentially like pain, bloating, and diarrhea, what they would do is they would take out a single food or maybe a group of certain foods and then see if their symptoms improve. And you might need to do that more than just a couple days. So I generally recommend, if you're going to do a food kind of intolerance test at home, you need to take all potential triggers of your symptoms out for 2 to 4 weeks.
That's really good to know, just to keep that in mind, that it's a process when you're trying to figure out what it is that you're...
and then if your symptoms do improve with withdrawal of those foods, then you would slowly add foods back in and then monitor your symptoms that way.
So do you find then that people with food allergies or intolerance may lack some of the vitamins or minerals, or what do you recommend then for people to do to still receive some of those vital vitamins and minerals that they need?
Yeah, that's a good point. I think it's important that as you're going through this process, you still try and maintain like a complete diet. And this is where the use of a registered dietitian can be really helpful, because they understand like the best way to make this kind of elimination process and then reintroduction process the most effective, so it's going to work for you, but also to make sure it's safe, because we want to make sure that patients, even when they're trying to figure out what their individual food intolerances are, that they're not at any risk of long-term nutrient deficiencies, like for say calcium or certain vitamins.
Right. And I think that's really good to know that you probably don't want to do that process alone, so that you probably would want to see a registered dietitian just to make sure what you're implementing into your diet now is something that wouldn't harm you.
Right. And it's so the use, like doing this in kind of tandem with your registered dietitian as well as your physician, I think is really important. Many times food affects GI symptoms, right? The GI tract is made to process the food we eat, and so oftentimes people feel like a reaction to a certain food after eating means that they have an allergy or a food intolerance, wherein they actually just have irritable bowel syndrome that is reacting to any stimulus in the GI tract. So the fact that they're eating it all doesn't mean they have an intolerance to that type of food. It means that their GI tract is sensitive and it's kind of has an exaggerated response with increased symptoms after eating. And so it's not necessarily even that specific food. So that's why treating both from a dietitian or a diet standpoint, but also treating your IBS from a medication or medical standpoint is really important, so that you can continue to maintain adequate nutrition.
Right. So then with you saying, it takes a team effort for this, what are some of the tips that you may give for people who suffer from food allergies?
So food allergies, definitely avoid those foods. And it's important to work with your allergist to continue to monitor for one, if you still have that allergy, because people can grow out of it, and for the development of any potential new allergies. So staying away from those foods, but also having backup medications in case you get exposure is incredibly important in terms of having as needed EpiPen or antihistamine medication.
Right. And then on the other hand, what are some of the tips then that you would give for people with the food intolerance?
So again, food avoidance is particularly important, but also understanding that if you do accidentally get exposed to that food or group of foods, the reaction, while unpleasant and uncomfortable, is not necessarily dangerous or harmful in the long term. So kind of having that piece of having that like rational information in mind can help you get through that.
Right. So now that, we kind of covered the differences between the food allergy and the food intolerance, we know that you're a doctor at Michigan Medicine. So we just wanted to know, what are some of the questions that you feel like will be answered in this area? What are some of the future questions that will be answered?
Thanks. So you mentioned how does somebody know if they have a food intolerance? And I think that that's a really interesting question to answer. So we know that a lot of patients with irritable bowel syndrome have multiple food intolerances or have a lot of increased symptoms after eating. And so how can we kind of do specific testing for that? So whether it's a certain blood test or a test based on their stool or microbiome, if there's a way that we can say, this kind of patient is going to do much better with elimination of these types of foods, or even maybe this type of food with this medication or probiotic, then I think that's really the next generation in terms to give patients a more tailored, individualized approach to not just like their diet and dietary plan, but just like their IBS care in general.
Right, and like you said, that really goes back to the team effort and having a dietitian and your medical provider being able to help you with those diagnoses and those treatments, but then also just knowing that in the future we're looking for a more tailored direction for some of these patients.
Yeah, right now it's kind of try this and then try that, and it's not really, we're trying to come up with a good plan for our patients, but often it's like you just keep trying something until it works.
Right, like you want to set a plan to give some of your patients hope, but right now that's the future. And
Absolutely.
You see this going in that direction.
Yeah.
That's so awesome. And, thank you so much for participating today and doing the interview for the GI Research on the Road. I really hope that, you guys who have tuned in today have learned something about food intolerance and allergies. And just, again, thank you, Dr. Eswaran, for bringing your unique insight to this topic. And, again, we really appreciate you.
Absolutely. Thanks for having me.
Thank you.